Hi, everyone. I'm Dr. Diana Bitner, co-founder of True Women's Health and Chief Medical Officer. And we're here tonight to talk about goal setting for 2025. And we're all going to talk about this a bit, but I care about this so much because what I do is not about me. It's you. I can't help you if I don't know what you want. And I tell patients all the time, I don't have ego invested in what you do. I want you to know your evidence-based options. And Dr. Egan, I'm sure you've got some thoughts about this.
Yeah. So hello, everyone. For those who don't know me, I'm the internist and obesity medicine physician at our practice. Although I feel hard saying that because we have Dr. Mueller now who also does those things. So I'm no longer the solo person who's doing all this stuff. But as Dr. Mueller and I both know, we reiterate what Dr. Bitner says, which is, we sometimes feel as doctors that we give women a laundry list of things to do, and it feels like just adding to their to-do list. And so one of our favorite parts of being at our practice is sort of talking with patients about what their goals are and what they want to do. And January does feel like a big month for goal setting with the new year. And so it just felt so appropriate to talk about it. Tricia, what do you think about goal setting in terms of, you come from family medicine.
Yeah.
A lot of that, but kind of give us your insight into that.
I mean, I think it's important. I feel like January is sort of that reset month for everybody where they kind of think about what goals they have for the year. And I think it's important to set you up for success when you're setting goals. The more specific and the more detailed they are, and then just kind of talking about those goals and working through it can help you be more successful at achieving it.
Yeah.
It can be a lot when you come into a doctor's appointment and you might come with your list or questions or, concerns. And we want to make this easy to do. We want to make where talking about your health goals, your goals for your aging is really straightforward. And we have a good way to talk about it. We use some language around picture of self. And picture of self means, how do you picture yourself maybe at a future event? Some people think in milestones. I tend to think that way. I don't know if it's college and med school and residency and all of that, just in the habit of thinking milestones. But picture yourself as a way to think about, again, how do I want to be at a certain event? Right now, I'm thinking about my picture of self skiing in March. I want to be strong. I want to be confident. I want to be in shape. I want to fit my snow pants. So it's like, how do we have those goals? And then just to picture it as much as you can. I remember first meeting you, Celia, and you were like, I like the language around that.
Yeah. And I think because, for a lot of times when I'm doing normal medicine, right, when the office beforehand, I was sort of talking to patients of being like, well, this is what I think of how you should be. And this is what, BMI I think you should be. But truly, that's not what matters. What matters is how a woman feels about themselves and where they want to go. And I think sometimes it can feel silly maybe to say like, oh, like, where do I want to be? But truly, it's so important because even it's pausing for a moment because women are thinking about so many other people, right? Even to pause for a moment to have a moment for them to reflect on themselves. And sometimes it's, how we feel and how we look, but sometimes it can be even something more insightful, even like about your sexual health, right? Of, where do I want to go with my sexual health? Maybe I want to have more sex. Maybe I want to have less, even just taking the time to sort of think about all those different things that we maybe don't have time to think about.
I think
go ahead.
One of my favorite things for a picture of self is just the variety of things. Like it's very interesting just to hear each person's perspective because it varies so much. Somebody's picture of self might be completely different than someone else's. So it's kind of fun. I agree, Celia, that we often kind of talk to the patient and this is kind of what you should do, where when we look at the picture of self, it's really the person that we're talking to is telling us what they want and what they see themselves as. And I think it's actually fun and it's interesting just to listen to them reflect on that.
Yeah. When I first wrote this program way back when, I had this image of like this woman facing her future and like, how do I want to be, reckoning back to the days of graduating from high school, graduating from college, like the world is our oyster, everything is possible. And like, then life happens, right? So how can we bring back that feeling of, I'm 58, I'm just getting started, like bring it on. Like, how do I want this to be? Like, we don't want things like perimenopause, menopause, like a health condition, et cetera, like being that barrier that makes you feel like what you were dreaming of isn't possible. So we want you to believe that what you want is actually possible.
It was funny today. I was actually talking to a patient and we were talking about the difference of how we're aging in comparison to maybe how some women who are a bit older are aging, and how like we just don't want to accept like the curly gray hair look like that so many women just sort of
Not
took
that there's
up.
anything wrong with that.
Not that there's anything wrong with that, but there is that sort of stereotype of like, oh, like you hit menopause and now you're supposed to transition into this like kind of stereotype that is this like old lady. And that we're both like, no, we're not going to do that. We want to keep working out and looking good. And I mean, for heaven's sakes, look at Demi Moore. She's 62. Like, what on earth is she drinking? Right? Like, right. It's okay to like have that conversation to say, I want to be that way or not. You could say, I don't want to be that way. I want to be super cancer free and I want to do everything to sort of prevent cancer, or I want to run a marathon and that's what it means. Or, you know, there's just so many other options that are out there.
Right.
Yeah. I think, and the nice thing at True is we're able to have those conversations and plan, and I think just be prepared for what is ahead, and then kind of own it, how we want that to look and how we want it to be for us, and just own that picture rather than relying on just things happening.
Yeah, exactly. We don't want to, just like we don't want to be an accidental parent. We want to be, we don't want accidental aging, like things just happening. So that's a perfect segue into Waypoints. So Waypoints is a program we use here at True, and it stands for WAI, Who Am I? And again, this is all about, again, not us as providers, but you all as patients, as women going through your lives. And to make this, once we develop that picture of self, to break it down and keep it organized and really, learn what each person wants to focus on, we use these 10 areas of wellness. So just like you might go to a financial planner and say, hey, I want to retire with $2 million. We're going to say, again, what do you want? You want to get down on the floor with your grandkids. You want to be active at 80. I want to ski when I'm 80. Like, what do we want? And so then we break it down. So in terms of your ability to be active, what is your picture of self in terms of your level of activity? What do you want to be capable of doing? So for example, you want to be able to run a marathon. I want to ski. Do you want to, again, you might want to putz in the garden and go to the grocery store. That's cool, but let's keep you doing what you want. And a lot of women will also talk about independence. They don't want to depend on their kids or their partner. They want to, be able to carry their own suitcase and carry their own groceries and, go out and about. So, have you committed to that? And then we use this to then help understand where you are. Is there a gap? What are your barriers? And let's solve. Celia, you want to talk about B?
Yeah, B. So we think about B as, we label it obesity, but really it's thinking about what is going on with your body composition. Is your fat mass where you want it to be? Is your muscle mass where you want it to be? Is that something that we can improve? Obviously, we know there's a lot of ins and outs that if you've ever listened to me talk at all about weight, there's a lot of ins and outs that go into our body's biology of deciding what that fat mass should be. And it's really complicated. I mean, as the last couple of years have told us, there's a lot of good avenues to go down in order to improve body mass. If that's something that bothers you or your body fat content, we're strong believers in improving your muscle mass to get it to be as absolutely as high as we possibly can be. And we know that we're working against aging for that because, over time with hormonal shifts and aging, we tend to lose muscle mass. And so if we want to maintain muscle mass, there's a lot that we have to do in order to keep that going. And really it's being okay even with where you're at. Maybe you have a body fat mass index that was higher than when you were younger, but maybe that's okay. And sort of just being comfortable with where that is.
And then, cancer risk, we ask people, do you want cancer? And of course it's like, are you kidding me? No. But like I talked about on TV this morning, it's like, we now know that alcohol is a significant risk factor. So how bad do you not want cancer? There are really a lot of things you can do. And whether or not you get cancer might depend more on your habits than your genetics. So again, we break that down and go into that.
I also think it does pause because there's so many new advances in cancer screenings that are coming out. And we really like to provide this as an opportunity, even just to reflect on, is there anything new that you're maybe not doing. And we sort of pride ourselves on having the latest and greatest in terms of cancer screening that we vetted. And I think every year it can be helpful just to make sure that you just know all the options. You don't necessarily have to do them, but it's just good to know all the options.
Right. And again, starting with that picture of self, what do you want? Like, if you're not real clear that, what is your vision for yourself in the future, whether or not you have cancer? I mean, again, I think it's sort of this cloudy, of course I don't, but that doesn't count to me, it doesn't apply to me. At some point, it's like to say, I don't want cancer. And then, Celia, to your point, like, what are my risks? And then, is there a gap in terms of what I want versus where I am? And then, what are your barriers? Is it that you are a BRCA2 carrier? Let's address that. All of that. So with, Trish, do you want to talk about the next couple?
Sure. So diabetes, I think, one of the statistics is that 1 in 3 people are pre-diabetic. So nobody wants to have diabetes, but there's so much we can do to prevent becoming diabetic. So understanding your risk and actually finding out where you are metabolically, how your body's operating. And if you're pre-diabetic, it's not a life sentence. It's something that can be reversed. We can work on your metabolic health. So just understanding how your body's operating and just knowing that there's a lot of it out there and we can prevent it rather than waiting for you to become diabetic.
And we hear it from a lot of women. They're like, well, I don't really want to know that I'm diabetic, and we don't want to know that maybe score of a hemoglobin A1C or wear a CGM and watch our sugar sort of spike. But the fact of the matter is it's already happening. And so if we know, then we can be sort of proactive and make some switches if that's bothersome to you.
And the other cool thing about it is it explains a lot of times why you're tired, right? People say, I want to have good energy. I don't want to be tired. It might be that your blood sugar is really high or really low or fluctuating. Or why are you craving all the time? One of the reasons for craving, right, is more visceral fat, is more belly fat, and all the biomechanical, all the messages that come from that fat. And so it's can be really helpful to know what your risk factors are for diabetes to explain a lot of those symptoms.
Yeah. Right. And I think just knowing the long-term complications of diabetes too, just understanding what it can do to our bodies long-term. So just that knowledge to help. A lot of people don't want to know, but if you have that knowledge, it's so powerful to prevent or treat rather than waiting till complications happen.
Yeah. And the other thing too is people might say, well, I don't want a heart attack. I want to be really healthy. I saw my father suffer from having had a heart attack, and then all that comes after that. Well, then part of that is having a normal blood sugar. So our blood vessels aren't so sticky, and so we feel better and all of that. So it's looking at those other risk factors. And again, the cool thing about these areas of wellness and waypoints is that they all feed into the other. Then we look at E, which is ease of coping. This is one of my favorites because we know a lot about women who cope versus women who maybe didn't see other women cope well. They don't have those skill sets. So, ease of coping is, do you want to be able to cope well when life happens? Because we all know it does. So when things happen, do we want to be strong, or of course we don't want to fall apart? So how do we cope well? And there are truly are tools, there are skill sets, and we know that women who cope well, as they believe they deserve to be happy, they keep a support network around them and they ask for help. So again, it's first committing to what does your future look like?
Yeah, I think I see a lot of overlap with this, waypoints in terms of obesity management, because a lot of people do rely on food as a mechanism for coping, right? Food is a very easy outlet if we're stressed or overwhelmed. I know I definitely fall into that category. As like a busy mom coming home and kids are screaming, you're like, oh my gosh, just give me some chips, right? And it can be helpful to pause and even reflect on how much we're relying on, ultra processed food as a mechanism of coping. And maybe we want to change that.
Yeah. And I think it's important too. So if I have someone who's struggling with weight loss and they're truly eating really healthy and they're doing everything and they're super active, sometimes we'll just take a step back and reflect on their stress level and how they're handling that. And sometimes it's just that stress is so high and their ease of coping is really playing a role in how their body's metabolically functioning. And so they can be all of these waypoints crisscross and cross pathways and interact with each other. So sometimes just taking a step and looking at some of the other ones that we think maybe aren't a concern, we can delve in and find and uncover some other areas.
Exactly. And then in terms of like phase of ovarian function, it's, I'll ask a patient, like, how do you want to go through this menopause thing? How do you want to go through your menopause transition? And they'll say, oh my gosh, I saw my aunt go through it or my older sister go through it. And I don't want that. I don't want sleepless nights. I don't want hot flashes in a meeting. I don't want fatigue, weight gain, all of that. So again, it's committing to how do you want that phase to be? And then in each of these categories, we then will say, what are you? We'll use some numbers, some metrics. So for example, a 3 in the phase of ovarian function means that your symptom score is high, meaning your symptoms are how you want them to be. You have a good knowledge base and you know what to do. And so a 2 is, everything's moderate. 1 is symptoms are terrible and you don't know what to do. And that can be really confusing. So if you decide that you want to know and you don't want symptoms, okay, let's address it. Let's figure out what options might work for you.
I mean, I think integrating more of phase of ovarian function into my practice with women has been imperative. I don't think there's another sort of way around it. And I think it's always been helpful to have women just even pause and reflect on where they're at.
Yes, I agree.
Know your phase of ovarian function.
Yeah. So the next waypoint, talking about having healthy bones. We need healthy bones because they're sort of the structure for which the rest of our muscles move. Believe it or not, as we age, falling and breaking a hip is actually a major factor in mortality, which feels really frustrating. If you haven't had a heart attack, you don't have cancer, to die from a fall feels kind of silly. And so we want to make sure that women know where their bones are at and reflect on that. Believe it or not, I've had a couple of patients who that is their main concern in their life, is making sure that they have healthy bones. And that's been a really interesting conversation.
I think it's important too to know your bone health. Like, our bones, we develop our bone density up to a certain age, and then after that we start to lose it. So if we're in our 20s and we can start to focus on bone health then, rather than when we have a fracture or we have osteoporosis, I think just having those conversations early on can help us understand our bone health too, because I think a lot of women don't know where their bone health is. And so that's important to understand even while our bones are still developing early on.
Yeah. I remember I told a patient, she was like 52, had her first bone density, and she already had osteoporosis. And of course, we uncovered risk factors that she didn't even know about, but she's like, she was angry. She felt very betrayed by her body, betrayed by the healthcare system. She was mad at everybody, including herself. Like, how did I not know this? And now I have osteoporosis at 52. Are you kidding me? And so the more we can think about, again, committing to, I want good bones. I really want good bones. I want to ride horses and ski. So I got to have good bones. But that goes back to body composition. We know that having a good muscle mass is so important to maintain good bones, because they're pulling on the bones and keeping the bones stable. And it's just so important for bone density. So again, it all fits.
Yeah. One of the things that I've learned sort of my process of, thinking about obesity management is actually people who have gone through rapid weight changes. So kind of that yo-yo dieting world actually can lose a good deal of bone mass. And so, if you're a person who's had major swings of your weight over your lifetime, that can be even a trigger to say, maybe I should get my bone mass checked out.
Excellent.
Yeah.
Heart disease, I know for an OBGYN, it's not always where we focus, but when I was delivering babies and learned that preeclampsia or high blood pressure in pregnancy can increase the risk of heart disease, I was like, wait, how does this all work? And, it all goes back to the health of the blood vessel and all the other factors, but it really made me want to ask women, like, how do you want to be? This is a leading cause of death for American women is heart disease, heart attacks. Like, do you want to develop this, which can be silent until it's not? And so again, needs to be a pillar of women's health and heart disease. So again, I would ask all of you out there, like, do you want heart disease? And if you don't, and you commit to that, then let's take a look at that. Do you want to be a 3, meaning really good heart health, moderate, or at a high risk? And then we look at primary prevention, meaning you don't have heart disease, and how can we keep you from having? And then we look at secondary, meaning you already have maybe early heart disease. how can we help that not progress and not have that be your cause of death or what keeps you from doing things.
Yeah.
Again, Celia, when we first met, this was something we just really connected on.
Yeah. And I think, so many women die from heart disease that is preventable. I mean, majority of the cases are preventable. And I think as time has gone on, even in the time that I've been a physician, I feel like the labs and imaging studies that are available to screen, so look for asymptomatic disease, as well as test for more clear risk factors, has continued to expand. And every woman should at least be given the opportunity to have those tests if they want. So something that we call a calcium score, which is looking for the calcium buildup in the coronary artery, which is a sign of scarring that eventually leads to blockages and obstructions and heart attacks, is something that we sort of offer all of our patients if they think that would be necessary. And so every woman sort of should be given that opportunity, kind of 40 on up, or if they have a really strong family history of heart disease.
And then I think too, just understanding, we get a basic cholesterol test done often at the office, but we can do a deeper dive into cholesterol and what does that mean and how is our body, and sort of individualize the plan for the patient and just have them have a better understanding of what does high cholesterol mean. So it's not always a bad thing. And it, high cholesterol is sort of a gray area. What does that mean? And we can kind of delve into it a little bit more with additional testing that we offer as well too.
Yeah.
And years ago, go ahead.
Intrigued by the major switches of cholesterol levels and blood sugars with perimenopause and menopause. Mm-hmm. And we hope that more research is poured into why exactly that is and preventing that from happening. Of course, we're not there quite yet, as more research money gets poured into women's health, but it's important to know that those things actually do shift and change. And a lot of women, I think, feel guilty almost. They'll come to us and say, I didn't do anything different. What happened to my cholesterol? I'm like, yes, that can be part of the perimenopausal time.
Well, yeah. And like you said, in terms of blood sugars, we know that women who take estrogen and started early in their process have a lower risk of progression of that calcium score. And they have less risk of diabetes, their blood sugar's under better control. So we know that estrogen plays a critical role. A study that got my attention early on in my journey to learn more about menopause was the study that showed that women who have menopause at 45 or under, let's say they have a surgery and their ovaries are removed or they have spontaneous menopause, their risk of heart disease is like 10 years earlier if they're not able to or offered to estrogen. And so their risk of heart disease, their whole life trajectory just changed by menopause being at 7 years earlier. So again, it's just really, really critical. Again, you think about, do you want heart disease? And then what can we do about it? Yeah. Income security was something that, I added to waypoints, and, we don't always focus on this when people come in, or people might have questions about it. But how I thought about this was, if you're worried about money, if you're worried about paying your bills, if you don't feel independent or secure in your income or what you're planning to do with what you have, like that can really affect health, right? Like if you're up all night worrying about, again, paying your bills, you're not going to sleep well. Maybe you're not able to eat well or choose healthy food. You're not able to afford, maybe you want to go to a gym and you can't do that. And so having that sense of income security, also it's a part of being independent and being, feeling confident in your future. And so with this, I developed it with a financial advisor. Certainly that's not my lane, but looking at, if you want to be secure in your income. I'll never forget, we had a patient in the pilot study who all of her areas of wellness were locked down except eye. And she's like, I don't feel secure about my income. If something happened to my husband, I can't support the family. My health is pretty darn good. I'm, young enough. She went back to college because of her really thinking about what does she want in terms of her income security. She went back to college and she got a degree, and now she felt very secure in her ability to support the family and support herself. So that was really exciting.
Such a great story.
Yeah, great.
Yeah. I think Candy has a question for us. She says, I was given the pill at 38 due to heavy periods. 4 years later, I got a DVT, which is a blood clot because of the pill. Would estrogen still be an option for me?
I love this question. Do you want to take it?
Go ahead, Dr. Bitner.
Well, this is something that, of course, as an OBGYN, I've taken care of women, and the birth control pill would certainly be something that we used a lot. The difference with, let's say, the estrogen in a birth control pill and the estrogen that you would take with menopause hormone therapy is a lot different. The estrogen in a pill is synthetic oral estrogen, and it goes through the liver and it can raise your clotting factors and really does increase your risk of a blood clot. Now, many women take the pill and don't get a blood clot. So we would be concerned that you would have a secondary reason for blood clot, i.e. something called a Leiden factor 5 or a protein C or S deficiency. And so those are things that we would need to test for. If you didn't have those other secondary causes and it was likely just due to the estrogen in the pill, potentially, based on maybe other factors, we could look at estrogen that's bioidentical, FDA approved, and through a patch. So again, this is a little more complicated. This is something we'd really need to have a conversation about and informed consent, but it doesn't mean it's off the table. Do you guys have anything to add to that?
More that I think it just highlights the importance of finding someone who understands menopause and menopausal hormonal therapy, or the new phrase what we're using for hormonal replacement therapy. Because if you go to just a physician who maybe doesn't do this on a day-to-day basis or hasn't spent the extra time to learn the ins and outs, that they may just give you a blanket answer of no, because that sort of just feels like the safest answer, but it may not be the right answer for you. And so if I'm not sure if you live in our area, but we're always welcome to see everybody, but you can also go to menopause.org and find a menopause provider that's in your area that can maybe be able to give you a really educated answer, like Dr. Bitner.
Yeah, and Dr. Egan took her test. She's a certified provider. Dr. Mueller just passed her lifestyle boards and now studying for the menopause board. So this is something that as one becomes a menopause provider, that we learn all about this. And again, we want you safe, but also want you to have options.
Yeah, what a great question. Thank you.
Thanks, Katie. And last but not least comes in sexual health. So this was Dr. Egan's idea to pull it out of F. I love it. So X for sexual health. And again, really getting people to commit. How do you want your sexual health to be? 15 years ago, I wouldn't have been able to talk about this, but with really good training from Ishwish and a lot of experience talking to women, like sexual health is such an integral part of overall health. It helps us feel vital and connected and all that good stuff. And so it's really important, I think, to have some structure around how to talk about this.
Yeah. I mean, I feel like it was just time listening to you talk about all the different aspects of it and like looking at the sex deck that I was like, this needs its own dedicated space here. Yeah. So, and I think that's really exciting. And I also think it's such a great window even into your own health, right? So we know that we've done many, I think 2 or 3 Facebook Lives about the overlap between sexual health and blood sugars and our body's ability to have maximal sexual health, having a great orgasm. And it has to do with the blood flow to those organs. And if our blood sugars aren't in the right place, then that may not be as impactful. So I think even just your sexual health is such a window into your overall health.
Or even I saw a patient last week who was having issues with orgasm, and it probably really relates to her ADD and distraction and teenagers in the house, right? It's not a physical thing. It's a psychological, with everything going on. So we talked about some ways to get around that. And she's really looking forward to seeing what that looks like. So again, it's a fun thing to be able to talk about once we have a way to talk about it.
Yeah. And Missy just put up checking out our sex deck. If you're not part of our office, please go check out the sex deck and learn more about different ways that maybe your sexual health isn't optimized, and maybe reviewing some of the barriers that you could overcome to sort of optimize your sexual health if you have a low libido.
Well, can you guys believe it's already a half an hour into this? I think we could talk about this forever. And I know we also want to talk about goal setting. Dr. Egan talking about weight loss solutions in terms of goal setting.
Yeah, we'll briefly just pivot. I mean, I would say a lot of the times when people start talking about New Year's resolutions, I swear a lot of it resolves around losing weight and eating healthy. We're going to put up our pyramid, because when we talk about losing weight, this is what I think about when my patients come in and we start talking. So in order to lose weight, to get started, this is what we call our weight loss pyramid. First, you have to think about your mindset. What is your relationship with your body? What is your relationship with food? What is your relationship, as Dr. Mueller pointed out, with the outside world, with your partner, with your kids, with work? None of this is going to work if that is not thought about. And it may not be perfect, but if you can't do all these other things, if you don't have a good relationship with food or your body. The second sort of pillar of this is nutrition. So, there's a lot of different diets that are out there. I even hate using that word diets. Finding the best diet that works for you is one that you like and is sustainable. A lot of the times, we have some threads that are pretty common. We like lots of vegetables that have a lot of fiber in them. A lot of the time we find a lot of benefit from eating protein. A lot of the times we're pulling out some of that ultra processed food. What does that mean? It means looking at the label and seeing words that you don't understand what they are, that tend to be chemicals. Those really change the balance of all the hormones between our gut microbiome and our brain and our fat cells that are trying to collect information and understand what to do. All those chemicals that are in ultra processed foods really throw that off. The last pillar is making sure that you're on the right medicines. You may be a candidate for the anti-obesity medications. You can't pick out a newspaper or look at a news website without reading an article about these new medications. They really are groundbreaking and impressive. They're not for every single person, but they're probably for a lot of people who are struggling with obesity or a overweight and an obesity related comorbidity, such as diabetes, hypertension, cardiovascular disease. What's really exciting is that they're also showing benefit in weight related comorbidities. The greatest news was that it was FDA approved. These drugs were FDA approved for obstructive sleep apnea. What do these drugs do in general? This new set of anti-obesity drugs, you know them fondly as Ozempic or Wegovy or the injectables. What they do is they mimic GI tract hormones, and they go to many different places in your body to do what your body thinks it would do if it had a huge influx of food. So your liver works better, your muscles work better, your fat cells are responding more appropriately, your brain responds by feeling less hunger, having better control over food, and really they're quite impactful. If you choose to do a medication like this, you really should do it with a professional. We're finding a lot of people are finding them at pharmacies that are not monitored by physicians
or spas,
spas. That's something that we really would prefer people not to do. These are real drugs that can be harmful. They have side effects just like every other drug, and we want to just make sure the right patients are on them. We've just like any medication, we've had side effects and complications, but we've been able to take care of that, learn from it, and be able to coach our patients appropriately. One of the things I worry the most about is patients actually not getting enough nutrition. It is not a get out of jail free card where you don't have to think about eating at all. No, we still have to think about getting enough protein. We still have to think about getting enough fiber, and all that is really important. The inside pillars of weight management, you got to make sure you're sleeping. You got to keep your stress under control. And the last pillar of being stability, that's about maintaining muscle mass, keeping your heart strong so that, we finally know that as exercise. But women tend to not lose weight just with exercise alone. You still have to think about nutrition and optimize your medications. But exercise can be a great weight maintenance. So if you're someone who's achieved weight loss goals, thinking about getting that exercise program in place is really imperative to sort of keeping weight maintenance. Julie Wise asked a question. I want to try protein shakes, protein powders. How do we know which ones are clean or healthy? Oh my gosh, that's a very great question, Julie, because there's a lot of things in protein shakes. So the backbone of a protein shake is some sort of protein source. Majority of them, I would say half of them come up with what they call whey, which is a dairy product, basically. That's how they use dairy to extract the protein components. Or now they're making a lot of more plant-based protein, like from pea protein. And there's a couple of other varieties, but that's the majority of what's made up. Then there's, protein powder itself kind of tastes yuck. So they have to put something on top as a filler to make it a bit tolerable. That's where you may pick and choose what works for you. Some of it is sugar, flat out old-fashioned sugar. Some of it is sugar alcohols or artificial sweetener like Truvia or stevia. It really just depends on what works for your body. And then there sometimes can be other fillers, and it just depends on what your body tolerates. I would say anything that keeps you feeling pretty satiated tends to be one that you would want to rely on. if have it in an hour or two, you feel hungry later, then maybe that's not the right protein source for you. In general, we like the ones that add in other vitamins too. So we sort of lean on what we call officially meal replacements, which are FDA approved protein shakes that have everything you need in them, which means have all the nutrients that you would need to not eat any other food. So those are the ones that we would prefer. But those can be expensive, hard to find. We have them at our office, but not everyone can get in there. So it's just really finding the right one that works for you. Anything else to add? I did a rapid fire breakdown of weight management.
So, yeah, I think the one thing I would add is, I've heard you talk a lot about, of course, all the other medications. Medications don't, of course, just mean the injectables, right? They might mean metformin for insulin resistance.
Absolutely.
It might mean phentermine or Contrave, or just briefly to talk about other options. And well, let me back up even more. I've heard you talk a lot about it's figuring out why is someone gaining weight or why someone can't lose weight. Again, is it the perimenopause? Do we need to look at the estrogen, for example? But again, for you, is it someone has cravings? Is it someone has again, just briefly touch on that if you would.
Yeah. So a lot of the times when we're thinking about what are the barriers for people making the right choices that would lead them down one of these pathways. So if you have really struggling with high cravings and you have we think of that's our relationship with food. So cravings is different than hunger. So, hunger is your belly's empty, your body's depleted of energy, and it's ready to eat again. Cravings are the I wants, right? I want chips. I want cookies. I want just something in my mouth. I need to eat something. I want to crunch. That comes from a completely different part of your brain. When cravings are a big thing in your life, it feels very uncomfortable to make a whole food choice, right? Everything in your body is telling you to go eat something ultra processed, or it's rare that we have cravings for something healthy. No one ever comes to my office and is like, oh, I'm craving broccoli. I can't stop eating broccoli. It's usually, sweets or fat and sugar tend to be a common one together, like cheese and crackers and charcuterie boards, that kind of stuff. So we try to figure out a pathway to get those cravings under control. And that may be sort of the first step in everything that we do with weight management. The first step is sort of acknowledging that the feeling you're having is a craving. The second step is putting some sort of objective measurement around it. So, we say that we want you to ride the craving wave, which your cravings will come like a wave. They will peak and they'll fall. You're not going to have the cravings the rest of your life. But the big question is, can you ride that wave until sort of it goes away? We like to give women sort of a plan, because sort of just, telling a woman, oh, you have all these chocolate cravings at 9 p.m., just deal with it, doesn't tend to be as helpful. So we like to give women a plan. And this is sort of part of our nourishment journal. As you can see, the bottom is if your cravings are 0 to 1, right? We're just very happy and moving on, feeling very grateful for our body. If it starts to ramp up to a 1 to 2, we're going to pause and just sort of deep breathe through our cravings. 2 to 3, we talk about distracting ourselves. Okay, maybe we're going to go outside. Maybe I'm going to take a walk. Maybe I'm going to go do something creative or productive. Phone a friend as a way to sort of get over it, start to sort of ride that wave. 3 to 4 is replacing. All right, I'm dying for some chips, but maybe I'm just gonna have some cucumbers. I'll put some salt on it. I still get my crunch. I'm still eating, but it's not quite chips. Okay, but now we're at a 5. This is the highest. All right, I'm going to have some chips. We're going to get a small bowl. I'm going to mindfully eat. What does that mean? It means here I am. I'm going to look at the chips. I'm going to smell the chips. I'm going to taste the salt. I'm going to enjoy every little chip and ounce of it. And I'm really going to feel the point when I'm done and trying to keep it to just a smaller size. Really, what we don't want people to do is distractive eating an endless amount. So what's that like in my life? That's like sitting down with Netflix, Costco size bag of Skinny Pop, right? And just going to town. I'm not paying attention. My body just thinks that I need popcorn. There's not any sort of objective measurement around it. And you can better believe it, I'm going to overeat that popcorn. So if I'm really being true to myself and I can find sort of some find out that I'm in a cravings mode, put some sort of boundaries on it, being self-aware and self-forgiving. Your cravings don't make up who you are. They're a reflection of your day and what has happened to you. And, you know, in a loving way, just sort of ride that wave and kind of go through these steps and see if they work.
Perfect.
A lot of the times last thing to say, a lot of the time, some of the medicines we use can be really impactful of lowering that craving wave down. So yes, the injectables do this, but drugs that have been impactful for certain people, such as Contrave, which is a combination drug, or the drug Qsymia, which is phentermine and Topamax, both have been, even before the injectables, very impactful. And we still put people on those medicines and they still are helpful, even in today's world of some of these other injectables.
Excellent.
Yeah. Do you guys see, I know perimenopause can be a time when our cravings get worse.
They can, and perhaps it's that you have night sweats and you're not sleeping, and we know that sleep deprivation causes hunger and cravings. If you're exhausted, you might especially hit that 3 p.m. where you are wandering the office or home, you know, looking for coffee and cookies. And boy, if you do, then you're asleep on your desk until 4:30, right? So it's just really looking at those other symptoms that might then affect your craving. So yeah, it's a big deal.
Yeah. Tricia, and I know, you know, we were so grateful that Tricia has experience using the anti-obesity drugs. I mean, how impactful have you found them in your practice?
Oh, super impactful. I think there's, you know, so much. We have patients come in all the time say, I was just told it's calories in, calories out. And we know that there's so much more that goes to it. So the pyramid that you had up is great at showing all these different pieces that play a role and come together. I always describe it like a puzzle and all these different pieces. And just understanding why we eat. So many people, I don't think, understand why. So we're able to talk to them about that and to understand the craving and hunger. But the medications are extremely helpful, and the ability to just sit and talk to the patients and explain how they work and how it can help them. And I think going back to just making sure it's a provider that if there is a side effect that they are able to help you with that. I know sometimes we'll get patients who have side effects where they got the medication from somewhere else, and then they often turn to us to ask us to help them. So making sure that it's someone who is able to talk about those side effects, understand them, and help you if you do have one.
Yeah. And it's so interesting, even using some older drugs such as metformin. You know, metformin never did, nor will it probably ever get an FDA approval for weight loss, but it's been used in the weight loss world for a long time. And it's very helpful, particularly even in that perimenopausal time when we see that kind of swing up with blood sugars. And we really are trying to prevent that rapid expansion of visceral fat. And, you know, as a woman works on bringing down those barriers, right? Getting on an exercise plan and thinking about their cravings and getting the steps in place to get a healthy nutrition plan in place. It can be a great sort of drug to use transitioning in that whole space, you know, and it's cheap and easy. So as much as we talk about the logistics of getting some of the more expensive ones, metformin can just be such a great first step to get started.
Or even going younger, thinking a woman, you know, who comes in and says, my milestone is I want to get pregnant, but I have obesity and I have polycystic ovarian, I have PCOS, and, you know, metformin can be that perfect drug to get things moving. I mean, I've used that medicine for 30 years with patients before the injectables. And so, you know, now, of course, to have the injectables is even more effective and maybe quicker, but, you know, just for someone to feel now in control of their body. And we talk about this food noise, you know, people say, you know, I want to go back to school and go back to college, but I can't even concentrate because I have this food noise. All I think about is food. And people say when that food noise goes away, like, I didn't know you all, like, this is how it could feel. This is how you all are functioning. I had no idea.
Yeah, I know. I joke to patients because they're like, well, what does it feel like? And I'd say, it's almost like the Matrix. That's like taking the red pill versus the blue pill. It's almost like a different world that you'll be living in. And a lot of people, they come back and like, I had no idea that, as you said, that life could be a little bit more free of that. And that feels very rewarding to give women that. It's very exciting.
Right.
Yeah.
And so then, we'd love Dr. Mueller to talk more about lifestyle medicine. So congratulations, Tricia, on passing your lifestyle boards. I know you've been preparing for that a long time. And when you joined us, you've been studying, and I just love all those articles that you've been sharing. So I'd love to hear more.
Yeah, so I'm glad that the test is behind, but it's something I wanted to do, and I began focusing on prevention. And if you have a chronic illness such as diabetes or hypertension, it's possible to reverse that and not have to be on medication the rest of your life. So lifestyle medicine is an area of medicine that looks at, it has like 6 pillars as its support, which are on the screen. And I love this because there's so much crossing over with the seeds, the 7 essential daily elements, as well as the waypoints. And so, and it also, if you look at the pyramid too, Celia,
yeah,
kind of like the pyramid, just broken down. So a deconstructed pyramid, but looks at these pillars of nutrition, and particularly focusing on that whole food, on avoiding the super ultra processed foods. Physical activity, most people aren't even getting the minimum recommended physical activity of 150 minutes a week and a couple days of resistance or strength training. And when we look at the seeds, we focus on aerobic activity as well as strength training, especially in perimenopause and menopause, because we know that we lose muscle mass as our estrogen levels go down. Sleep, this is a great one. I'll get a lot of people who say, well, I sleep 8 hours. And I say, okay, but how much of it was really quality sleep? So looking at the quality of the sleep, because if you're in bed for 8 hours and you're only sleeping 5, that's not great sleep. So just understanding sleep pattern, obstructive sleep apnea is very much undiagnosed or missed. And so that plays a role in our metabolic health, diabetes, our heart health. So just kind of taking a look at that picture. And poor quality sleep is a common thing that I don't know about you guys, but I see that a lot. Stress management, so that ease of coping, and we live in a stressful world. So how do we cope? What tools do we have? And if we don't have them, what tools can we help patients have and help them through that? Healthy relationships. So we see this a lot more in our elderly patients, but social isolation. COVID was a great example of this. There was so much social isolation, and we know that can affect our physical health and our mental health. And then avoiding risky substances, so alcohol, smoking, drugs. So looking at sort of these pillars that make up our health. And so it focuses on that. And the goal is really prevention. But again, if someone has a chronic disease, we can use these pillars to work on disease regression as well too, and maybe take medications away. So that's my favorite thing to do. If someone's got diabetes or high blood pressure and we can work on these pillars, then we sometimes have the ability, it doesn't mean you need to stay on the medicine the rest of your life. So I think, and I was excited when I came because I saw the it overlapped with the seeds and the waypoints. So for me, it was exciting to see that. But that's kind of the background of it, and then just working with patients to figure out what their goals are and the areas they can work on. Because a lot of times I see number 1 and number 2 being worked on, but then we don't at the other ones, and there's so much overlap. And then when you look at seeds like nutrition, activity, mind, body, that metered breathing that we talk about, and sleep, they cross right over. It's like lining them up parallel. So that's exciting.
Fun.
Yeah.
Oh, thanks, Missy, for putting this up. Yeah, the seeds.
Yeah. I think that what was really interesting, I was just reading an article about the healthy relationships. They did some research on people who they call super agers, like these people who like live super long lives and like are super sharp. And the only thing that they could find in common was that they all had good support systems, like healthy relationships.
Yes.
And how like we don't think about that, but how really that is something that's impactful.
Well, they look at, if you look at the blue zones, which are these areas where
I was just going to say that
they live longer. And when they did data and studies on these blue zones, one of the common things is that they eat together, right? Like I think about how many times I'm eating on the fly or my kids are running out the door for sports, and we really as a family try to sit and eat together. And so they've shown in these blue zones that that's one of the reasons that they are able to live longer. And so social isolation it's difficult. And so someone's not interacting. And I think nowadays too, just with social media, right? I look at kids and our friends kind of joke, like our kids don't know how to interact. They're on their phones, they're on, TikTok or Snapchat, but they're not we didn't have that when we were growing up, right? We were talking in person. So just kind of making sure that people have a good support system, and that affects all the other areas. So it's a web, a very
well, I love the letter that the Surgeon General, wrote to the nation as he's, losing and leaving office. And he talks about how he sees, in all the studies and all the research and all the science that he's had purview to over the last 4 years, he says when he sees people being healthy, it's when they're passionate, when they have a mission in life, they have, a goal, something they feel really attached to. True does that for me in spades, but then it's also being connected to other people and having a sense of community and having a support system, asking for help when you need it, and then having availability of good nutrition, of course, and treatment of things that are not preventable. So again, focusing on that passion and connectedness.
Yeah.
So
well,
really
I think we gave people a lot to think about in terms of setting goals.
I think so. And I think, we could just talk about this
for hours.
Forever. Yeah. So if there's anyone out there with any other questions or comments, or, we just appreciate any feedback. We're so pleased to, be able to share this with you. So moving into, we always like to end these with 5 questions we want you to be able to ask your primary care provider. So if you're not here or are not seeing us here at True, these are things we want you to take forward into your relationship with your provider. So number 1, and this is almost always number 1, please ask your provider, what is my phase of ovarian function? This is just so critical in knowing all these things about your risk factors for all these things we talked about. So again, ask your provider, what is your phase of ovarian function? Candy, I see you again. What are you asking? Missy, can you put that up? Where are you located, and do you accept Blue Cross Blue Shield? So we are in East Paris and Burton in Grand Rapids. We're also available on telehealth. Saw patients today from all areas of the state, and we do accept most insurances. So please feel free to give the office a call or a text, and Elizabeth or one of our team members will be happy to chat. And Missy just popped some stuff up in the chat. So number 1, to ask your provider or ask us at True, what is your phase? What's number 2?
How will you support me in my goals? So this is important, right? So yes, maybe you have some goals and you're like, I was so inspired. Here I am. Your doctor should be able to help kind of provide some insight. Maybe it's seeing a dietitian. Maybe it's seeing a therapist. Maybe it is using some of these medicines we talked about. Maybe it's coming up with a better nutritional plan or working on stress management. Your doctor should be able to help you sort of get going on some of those things. So we really would love people to find someone who can be supportive. Number 3, I'll take this one. Am I a candidate for weight loss medicines? So majority, the guidelines say you're a candidate for anti-obesity medications if your BMI is above 30, or if your BMI is above 27 with a weight-related comorbidity. And that list is long. So diabetes, prediabetes, hypertension, fatty liver disease, obstructive sleep apnea. Interestingly, as I said, the indications for some of these drugs continue to expand. And so we're getting into a bit of a gray zone of understanding what that means. The overview of this is you need to find someone who truly understands these medications and can help guide any person into whether or not an anti-obesity medication is the right choice.
An FDA-approved anti-obesity medication.
And the FDA approved it, yes. Yes, thank you for clarifying.
Yes, number 4. Tricia, you want to take this?
Sure. What resources do you recommend to help me reach my health goals? So I think, one of the things is having a team approach, right? So having a lot of people on your team to support you and help you and cheer you on. So that, like Dr. Egan said, can be a referral to a dietitian. It could be further testing. So I want to understand more about my cholesterol or my heart and its health. And so having a provider who understands those tests and can help explain them to you and explain what's available so that you can make that decision. And then just understanding your symptoms. So how do I learn about that a little bit more? How do I understand my risk factors, and collecting that information? And then once that information is collected, helping you understand that. So having a provider who's willing to help you reach out to resources to better understand your body and to help support your goals.
I feel so bad. I remember for years as an OB, we did a lot of, I don't know if you call it primary care, but kind of primary care. And, we'd order a cholesterol and then it would come back and we'd send these stupid postcards would say, eat more fish and nuts. That would be it, like, good luck, so it's like, it's so embarrassing. We know so much more now, right? So again, it's having a provider that is not just a postcard telling you to eat better. So again, it's this team approach. And of course, Suzanne and Megan, part of our team that is not here tonight, like we all have different interests. And again, here to support you. So make sure wherever you go, you find a team. Thank you, Tricia. It was awesome.
Yeah. And we also want to have a physician that is open-minded to new things. So as we said, we sort of vet a lot of the new tests that we are recommending. We try to stay as up to date as some of the new technology coming out. Medical technology is like coming out fast with some of the advancements in AI and other stuff. Like for instance, we recommend a cancer screening test that's not covered by insurance, but is available to our patients called Gallery. And, we just want to give a shout out in the next couple of weeks. We're having an event on February 11th. If any woman, even if you're a patient or not, and their husbands or partners can come to get tested, because we really do believe in having that available to people in our community.
Yeah.
Awesome. Good.
Yeah.
And number 5?
I guess I'll take that one.
Yes.
Who I can see for lifestyle medicine. So it is actually a board certification. And so just like obesity medicine. So there are some people around. You can go on I believe the American College of Lifestyle Medicine website, and I believe they list those that are board certified in it. And if your provider's not comfortable that you're seeing wherever you're located, they should be able to help you reach out to someone who has done the board certification and has that background, who can help you look at all those pillars and really take a look at the whole picture rather than just focusing on one small piece of it. And so, again, we're complex. And so they can reach out and see if you're certified that way.
Perfect.
Awesome.
And then we like to move into the 5 takeaway tips. Number 1 tip is to try the true picture of self concept to get started with healthy aging. So again, think about how you want to be moving forward, or is it spring break, or is it a birthday, or it's a certain event? How do you want to be when that event happens? And imagine how your future would be if you choose to if you need to make changes, or if you need to just keep going how you are. And it's encouragement. So we just want you to have this as a way you can think about this.
Awesome. Number 2, understand your metabolic health and risk factors for disease. If you want to lose weight, know which ways will work best for you. There's not one way to do any of these things to bring your barriers down. It's the way that you think will work and that you find the most joy in doing, which is a lot of times what we even talk about with exercise plans. But you definitely at the very minimum should get your blood drawn, maybe throw a CGM on, see where you're at in terms of where your blood sugars are at. And don't be scared of getting that information, because it's there, it's happening to you. We just got to get working on it.
Yeah, I just saw a patient today who used a CGM, and she said, I'm blown away. My oatmeal that I was eating, my sugar went crazy. Like I had to break up with bananas, like the whole thing. And it's like, that's all it took was getting rid of those extra sugar highs. So again, it's so important to understand what's going on with your body versus someone else's.
Yeah. It's such a great tool.
Okay. Number 3, Tricia.
Know that True has a physician specialty trained in lifestyle medicine.
Yes.
Yeah. So if, I think that really is focused on if you're someone who maybe medications are not something that you want to lock into, that's okay. That can be part of your picture of self. Know that there are physicians out there who are really geared towards steering you in that right direction.
Yeah. And I also think too, I know with the GLP-1s that are in the market, the injectables, there's a lot of concern due to the cost, and just know that there's other options. That's not option out there. There's so many other things that we can offer and come up with a plan that works best for you.
Yeah.
Oh, I love what Julie said. She loves the CGM.
Thanks, Julie.
Thanks, Julie.
Awesome.
Yes. People just got to sometimes give it a try. Tip number 4. I love this one. Menopause hormone medicine. And we used to call it HRT. We're now calling it MHT. It's safer than you might think. So we know more and more that we feel very comfortable that estrogen does not cause breast cancer. And so we've learned a lot more about who it's safe for and who it's not. And so again, it's way safer than you might think. And so just to make sure you explore those options to feel your best.
Yeah. I always say every woman should at least have that option to turn it down if you want.
Absolutely.
Love it. And number 5, we want you to make a list of your health support team. So again, women who cope well, they believe they deserve to be happy. They have a support network, and then they ask for help when they need it. So that really does start with knowing who is your health support team. And, please, of course, we're here. Add us to your list. We have lots of resources available. For Patients of True, we have the Mighty Networks available as well, which we're able to share our platform of expanding information, resources, videos. We've got lots of, many sessions recorded on our YouTube page and our Facebook page. So please enjoy all that we have to offer. We want to reach as many women as possible. And one way is
Dr. Bitner's workbook. If you want to work through some of these waypoints yourself, if you're not in our area or coming to see us doesn't make sense, even just getting Dr. Bitner's workbook, it's available to kind of work through some of the stuff yourself. So awesome.
There you go. Yes.
Yeah.
We've got lots of options. So we wish everyone healthy aging in 2025. Thanks so much for joining us tonight. Thanks, Dr. Egan, Dr. Mueller. And
thanks, Connie. True is the greatest team, she said. Thank you, Connie.
Yes, thanks. We love what we do. I think it's pretty obvious. I just, again, even today, talking about our year ahead as a True team, I so look forward to great conversations, great debates. How can we just keep doing things better?
Yeah. And I think one of the things that I think we can guarantee is that we're all very passionate about making this happen for women.
Yes.
Yes.
And wanting to be part of your team to help you.
Absolutely.
Awesome. Great. All right. Thanks, everyone.
Hope to see you.
Bye.
Bye.